Today, I'm going over the top 9 foods for blood flow to your arms, to your feet, and to your private areas. And we're starting now. You don't want your foot doctor telling you how to get blood flow to your private areas. But the thing is, what gets blood flow down to your feet actually works a little bit better in areas closer to the heart. So use this information as you will, but I will go over specific studies for that particular problem as well. And hey, my biggest qualification is I have 4 kids. So the thing is, arteriosclerosis and stress and anxiety, all these things can prevent blood flow down to your extremities. One of the biggest problems in America right now is arteriosclerosis and atherosclerosis. Down to your feet, the blood vessels are called your arteries. They go to your private areas, to your fingertips, and these are surrounded by muscle. These are very thick, strong vessels, but what can happen is as the blood flows through there, it can irritate the walls, scrape them, inflame them, and essentially as they get damaged, they heal with blood clots, fat can deposit, and they can become more and more narrow, so there's less and less blood flow. There's a lot of great nutrients, and as we talk about the food, we'll go over them, that can dilate and open these vessels. And at the end, I'm gonna go over a supplement that's in a lot of these foods that can immediately help improve your blood pressure and increase your blood flow. So let's start with the top 9 foods. We're gonna count it down and we're gonna include a secret one that you should really consider taking. Number 9, pomegranates. Pomegranates are rich in antioxidants, particularly ones called flavonoids. These promote blood vessel dilation. So flavonoids open up the blood vessels. Studies suggest that regular consumption of pomegranate juice supports healthy blood pressure, attributing to its high potassium and copper levels as well as its low sodium content. Consumption of pomegranate juice can support healthy blood flow pressure due to its low sodium content. But here's the thing, pomegranate juice does have some sugar in it. I'm not a big fan of juices personally because diabetes rates are sky high, and diabetes is the single biggest cause of higher blood pressure and kidney issues, which then cause high blood pressure and blood flow issues. So maybe eat the actual pomegranate or consider other ways to get your flavonoids in your diet. Number 8, nitric oxide boosters. Beets. Beets contain nitrates that are converted into nitric oxide. I love beets. These are like a superfood. And I was born in Poland. We eat borscht soup. So that is essentially a red beet soup. That is one of my favorite meals. You put some pierogi in there. That is unbelievable. That's one of my favorite meals my mom used to make. But this aids in blood vessel relaxation and increased blood flow. You can also take beetroot powder supplementation when timed correctly, can enhance oxygen delivery, benefiting athletic performance or even bedroom performance, if that's what you need it for. A study in the Journal of Applied Physiology found that beetroot supplementation could improve cycling performance and increase oxygen efficiency. 7, berries. Berries such as blueberries, strawberries, and cranberries are rich in polyphenols, particularly anthocyanins, which have significant cardiovascular benefits. Studies have shown that consumption of berries can improve vascular function. This improvement is attributed to the protective role of berries in vascular function, which depends on the time of exposure, the type, the dose of berry. For instance, flow-mediated dilation and reactive hyperemia index, markers of vascular reactivity, so that's how much your blood vessels open and release blood flow, showed improvement following short-term interventions with berries. So essentially, what the studies show is when you eat berries, they open up and there's more blood flow. Other factors such as arterial stiffness reduction were improved over medium and long-term intervention. The exact dosages can vary because nobody really regulates the amount of fruit content, but it's important to note that there's a lot of water weight, there's a lot of fiber, there's a lot of good nutrients in berries, and there is a very beneficial role for them in your diet. Number 6, quercetin in onions. Onions, particularly those with higher quercetin content, have been historically used in promoting circulation. Quercetin's mechanisms include reducing oxidative stress, improving endothelial function, and modulating gene expression for better vascular health. Quercetin reduces oxidative stress, and improves endothelial function. This is essential for your vascular health. Regular consumption of onions has been shown to be positively impactful for your blood flow. But be careful, they're going to make you cry. Number 5, garlic. Garlic is rich in allicin. Allicin supports tissue blood flow and cardiovascular health. Optimum allicin activation occurs after chopping garlic. The preference should be given to organic garlic, and locally sourced varieties, they've been shown to have higher levels. For optimal benefits, garlic should be chopped or crushed for allicin activation. A study published in the Journal of Nutrition highlights garlic's potential in reducing blood pressure and arterial stiffness. And it's a great home remedy for moms and grandmas. Number 4, cayenne pepper and blood circulation. Spices have been known for opening up blood vessels, but capsaicin is a very important one. For my peripheral neuropathy patients too, you can put chili powder or capsaicin on your toes as well, and they hyperactivate your nerves at nighttime, and then your brain signals to it, hey, something weird's going on here, just shut off the nerve function. And in that way, capsaicin can make your peripheral neuropathy symptoms better. But number 2, capsaicin and cayenne pepper may dilate blood vessels, improving circulation and reducing pain sensation. Regular consumption of spicy foods like cayenne pepper has been associated with lower rates of cardiovascular disease. Number 3, ginger. Ginger has been well studied and is very beneficial in opening up blood vessels. This can be taken as a supplement. It could be taken as a topping. There's a lot of different ways to get your ginger in. Number 2, curcumin, which is found in turmeric. This is one of my favorite supplements. It's an all-natural plant from turmeric root, but the active ingredient is called curcumin. Now, when I refer to it, I'm talking about the curcumin dosages, because like any plant, they do vary with how much of the active ingredient is in there. Curcumin in turmeric enhances vascular function by doing a few things. It increases nitric oxide availability. It reduces oxidative stress, and it improves endothelial function. High-quality curcumin supplements with a superior absorption, and they do this by adding black pepper, can provide joint and muscle relief as well as thinning the blood flow. So if you're a blood clotting risk, curcumin is actually very effective as a blood thinner as well. And that has been very well studied. This is actually one of the most studied supplements. I have videos going over all the side effects, all the benefits, all the meta-analyses. Check that out below. And number 1, this is not our secret one, but number 1, omega-3 fatty acids from fatty fish. There's actually a lot of ways to get omega-3 fatty acids. Like one way I get it, and for my kids, when I make smoothies at night, I pour chia seeds in there. We love chia seeds. It's a lot of fiber. I can put some flax seeds in there too, but eggs have a lot of omega-3 fatty acids. But here it's fish. You can get it from cold water fish like salmon, but there's a lot of cold water fishes that have omega-3 fatty acids as well. Omega-3 fatty acids are extremely well studied. There's a lot of high-level studies. They help arteries, they help the heart, they help decrease inflammation. They also help increase muscle mass if you're strength training. Consumption of fatty fish, chia seeds, flax seeds, all these different farm-raised eggs, these can all help. The American Heart Association recommends eating omega-3 fatty acids at least a few times a week. I would strongly recommend getting it daily. If you can't get it in your diet, definitely consider supplementing it. The costs have come down significantly, making it much more reasonable as manufacturing practices have increased. But here's the big secret food. There is something that can dilate your blood vessels right away. And in fact, there are studies that show if you eat this food and this supplement, that basically for your private areas, it increases the blood flow within about 30 minutes. It's not as strong as Viagra, for example, but it drops your blood pressure by about 5 or 6 points, dilates your blood vessels, increases blood flow to areas almost immediately. This is an all-natural nutrient. It's called L-Arginine, and its related cousin, L-Citrulline. I did a video comparing L-Arginine to L-Citrulline. L-Arginine works almost immediately because it can pass through your stomach lining into your blood. But L-Citrulline is absorbed much better, but takes about half an hour to be converted to L-Arginine in your blood. These are both natural amino acids that play a significant role in cardiovascular health, specifically they increase nitric oxide production. This is what Viagra and like Cialis do. It's not as strong. That's obviously a perfected medication. But nitric oxide is a vasodilator, meaning it helps relax and opens up blood vessels. It quickly drops your blood pressure and increases blood flow to your periphery. L-Arginine is found in red meat, chicken, fish, dairy product, nuts, beans, whole grains, soybeans are good sources. The dosage can vary on the condition being treated, but generally you want about 2 to 3 grams a couple times per day. In some clinical situations, you could do more, but L-Arginine is used for improving blood flow. It works right away, but it isn't as absorbed as good as L-Citrulline. Research indicates that L-Arginine can improve vascular function, has the potential to help in high blood pressure and type 2 diabetes by dropping that blood pressure immediately. L-Citrulline, on the other hand, is a cousin to L-Arginine. It's converted through one step in your body, but watermelon is a rich natural source. It also presents in cucumbers, in melons. It helps with blood pressure. 3 to 6 grams is very helpful. Watermelon, for example, per cup gets about 250 milligrams. You don't want to eat 10 cups. This is where a supplement might make sense, unless you're really crushing cucumbers and watermelons, honeydew melons. It's also present in pumpkins and squash, nuts and legumes. L-Citrulline is probably the more stable and beneficial way to go than L-Arginine, even though both are great. If you want to compare the two and look at the supplements, check out my reviews on the studies on those below and how they compare to Cialis and Viagra and those. Check that out below.